good morning everyone. So thankful today, friends. It's a beautiful day. Not super hot, not super cold, but it's a little bit windy. So good. So I'm on the way, friends, to my alternative therapy. Look at, friend, I have a liter of water here because the IV that I will get today make me very thirsty. So it's a vitamin C 50 grams. Actually, the prescribed for me is 60 or 75 grams, but I don't like jumping right away because I need to condition my body. So far doing well and doing good and every day. So I will give some more updates to all of you once I get in my clinic. The way now, friends, to my clinic therapy. Hello, good morning. Hello, friends. I'm here now in my clinic. Hi. Hello. Oh my God. So look at this one. So beautiful here. Friends, I am alone here. Look. I am alone here. So I had, friends, look. There's a lot of scars now and bruises on my arms. I had 50 grams of vitamin C, vitamins, friends, because that's the prescriptions of my alternative doctor. The only IV that can melted down the tumor in my lungs and all the nodules. So at the same time, make my immune system very strong. So he said the more it saturated with vitamin C, the tumor will uh, bring back to my body, restore to my body. So that's the beautiful things, friends. Only vitamin C, very safe, uh, safe and non-toxic alternative therapy and killing cancer tumor. So I was very happy, friend, that I'm always strong every day, friends. Thank you to all of you. Thank you to all of you. Thank you, God, for directing me into this place to get the alternative treatment. This will be an hour, friend. 2 hours, I guess. 2 hours. So I guess I will close my eyes. Friends, look. I am by myself here. No one is here. But before I enter, uh, there's one patient there sitting down. This room is exclusive for cancer patient. So, and this side. So the first room there, yeah, it's for all regular patient or regular clients. Some don't have illness, don't have disease. They just want to build their immune system. So that's on the other room, the first room there. So, but if you had a cancer or undergoing chemotherapy, you will come to this room. So, and I'm in my favorite chair because look, friend, it's remote. It says if you want to recline, just press this one. That's how I take. So if you want your lean back, recline your back, or I'm moving. So if I want this straight, oh, I'm moving again. That's very beautiful to sit down here. So so I'm happy, friend, every day. I'm so happy. Despite the good news of my PET scan, so I announced to them. I tell them that there's a great news of my PET scan result. So so they have an idea also, you know. So I make them happy of the great news. I relate to them that my tumor did not grow from November to May 11 result. When my doctor compare it, it's the same. So because right after 2 weeks of my surgery and I was diagnosed, I came over here right away. I started my IV intravenous therapy. So intravenous is part of alternative treatment. So all this alternative therapy, building your immune system, removing the toxins, removing the free radicals, and killing some bacteria, because if your immune system is strong and there's a bacteria in your body, it will die. So so the way of treatment is building immune system and removing all the toxins, detoxifying through intravenous, because uh, I cannot depend on the oral pills only. It's not enough. So by intravenous, it helps me a lot to control the growth. But number one first, of course, faith and believe. So my faith was very strong. I believe God direct me to this place that I don't have any idea before, because God knows what is best for me. So this will be a wild friend. Still big, not even yet halfway. So, so I use this side fan from elbow, the elbow side, half of my arm going up, because the vein on this side is big. So I will not feel any pain on the solution of the vitamin C, because vitamin C is strong. So if you use the small vein, it's very painful. And all friends, uh, this clinic did not treat cancer patient only. So because mostly of the patients on that sites don't have illness or don't have disease, but they want to build their immune systems. Like me, all my allergies went away. So before I had eczema or atopic dermatitis, now it's all gone. So when I start the treatment, so there's a woman there. She just want to get a glutathione. So he always, because glutathione is used for detoxifying, cleaning the liver. So, so my package for this month of May, I had last week 40 grams of vitamin C. Today is 50 grams, and next week I will get 60 grams and one glutathione IV because I had a lesion on my liver. So plus I'm taking a lot of medications. It's number one, cleansing. So, but it should be administered by medical practitioner, glutathione. So you cannot just take it by yourself without proper monitoring or consultation. So I keep my glutathione to clear up my liver, to detoxify. Actually, friend, I had tablets or capsules I'm taking. Every time I don't have IV, I'm taking some tablets. But I don't, it's not enough. It's not enough, because the moment you take it, it will just go to the intestine and flush out in your body. So, but if it's through IV intravenous, it will go to the circulatory system. It will go to the vein direct. So it's more effective than oral supplements. So that's a good news. So I don't know how much will be the total cost for month of May, because this is alternative therapy. So I need to continue my alternative treatment, friends. So I told the nurse that his goal is to melt it down, all the dead tumor and nodules. And if all of you following my blogs, I had a videos or a blog that about why the tumor did not grow. So this is the place where I went, is where I started my treatment, my therapy last November 2020. 2 weeks after I was diagnosed and after my surgery. So this is the place. Was here. I came by here since November. But by that time, the goal is um, cleansing my body, detoxifying now, and building my immune system also, and healing process. Since I had a surgery, the therapy I got that time was to help heal up my wound inside my stomach because it's a very big surgery. So since I don't have medicine, my doctor prescribed me only a pain reliever because as if I told you in my blog before, they will not give you medicine here for healing. So it's your immune system will heal up your own wound inside your body. So if your body is weak, there's the uh, the growth of the healing, the recovery is very slow. Especially in my case, my hemoglobin was the time was very slow because I had 2 bags blood transfusion. So very slow. I always feel dizzy. My oxygen level was very slow. But I don't have medicine for to cure for that, for healing. So how can my wound will be healed up if my body is not strong enough to heal up the wound inside? I don't have medicine with that. My doctor, when I was discharged from the hospital, she gave me only pain reliever for 2 weeks supply. It's very hard. It's very hard. I cannot walk. I don't have strength on my legs. So right after that, uh, I pray friend. I don't have idea about this. So my sister, I inform my sister, and my sister found this place. So then I call, I contact. So I was very happy from that time. The first therapy I feel strength and I'm not catching my breathing. So 2 times a week, 3 times a week therapy last November, December, January. It's very expensive, but you know, uh, health is wealth. So I don't have a choice. So, but God provide, always taking care of our finances. That's beautiful things and great. I'm so grateful for that. And that's a wonderful things happen. So God direct me and put me in this place because He knows what is best for me. I'm almost done finally with my IV cream. So I guess only 5 minutes more remaining. Then after this, I will go to hyperbaric oxygen. And look, while I'm having my IV for 2 hours, I drink ionized alkaline water with pH 9.5. This is 1 liter, friend. So I drink almost while I'm having my IV because it dry up my throat and I need to keep my body hydrated to properly circulate the vitamin C in the vein, or else I will get headache if I am dehydrated. So this water helps a lot, not to give me any headache. Yeah, not to give me headache because this vitamin C is high dosage. So it need a water. So it's almost done 1 liter for 2 hours. Friends, I'm here in hyperbaric oxygen again. Look, I had a big windows in a big chamber. I had a window here and here. So I will not sleep, friend, because I will inhale all the oxygen. Because the tumor don't like oxygen inside my body. So until once it's saturated and soaked with oxygen, it will melt it down. That's an alternative therapy. Cancer tumor don't like oxygen inside the body, so it will restore and bring to good cell again. Since it's dead this time and considered as cancer tumor, so I'm doing this to kill it through oxygen. So I will not sleep today. I had also here, friend, this one release oxygen. Oh, look. Oh. This one release oxygen. It goes to my head and to some parts of my body because this is pressurized. Hyperbaric oxygen chamber. It's pressurized oxygen. So my ears start congesting again, closing. So I need to swallow. So it's only temporary. It's only during inflation and deflation. So I can feel the oxygen here, friend. The pressure goes to my head, which is so good, because our head need more oxygen. So good, friends. So that's all, friends. And this is so big. I like this because this is big. I like this, friend, because it's so big. So I'm sucking, friend, deep the oxygen. Inhale, exhale. This is so big, look. I'm almost half. Friends, I'm gonna with the hyperbaric oxygen. It's the technician deflating now and my ears was congested again. Plugging. So I just suck, inhale. Deep inhale, friends. And look, releasing now some air, some pressure here. This is so good. friends, I'm done now with my therapy, and I'm here outside of the clinic, as if you see the name in my bag. So I'm waiting for my hubby to come over here and pick me up. So good today. I finished for about 2.5 hours. It's a little bit early because it's Monday, it's full. So that the technician asked me if he can give me 45 minutes. I said, okay, 45 minutes of hyperbaric. So instead of 1 hour, because there's one more patient next to me. So it's fine, it's okay. So, but I feel better, friend. I feel very strong. So I grabbed some papers here, friend, look, to read. Because it's stated here that fatty liver and high cholesterol treatment plan. So if you had fats in your liver and your cholesterol is very high, they treat also. They have a treatment plan also for it. I'm so grateful, friend, that I found this place. It helps a lot. Imagine my tumor did not grow for 4 months. It's a big help, you know. So until this time, I'm just melting down. The program for me is to melt it down the 1.2 centimeter tumor size, which is they never expect it the same size since November, because of this IV therapies I had. It helps to control. But number one of also is thanking God for leading me and directing me to this place. Air, the environment here, look at that, the trees. So it's color mahogany. I don't mahogany color, it's combination of red and brown. It's beautiful tree. And this one also here, it's a lot of greeneries now here, and it's beautiful, and it's very windy around. So that's why I'm here outside enjoying while I'm waiting to my hubby to pick me up.